Respected dignitaries, welcome to this session on an introduction to renal health in Ayurveda. And we'll be discussing one important medicine, that is Chandraprabha Vati, also along with this today. So whatever we are going to discuss today is a superficial ideas about how we approach renal diseases in Ayurveda. And all these things will be dealt in detail in the upcoming course. So hope you all will be joining that as well. So first of all, before going into the renal disease as such, we have to understand some basic physiology, how Ayurveda understands the functioning of urinary system. So the term urine is interpreted as mutra in Ayurveda, which is one of the three malas that you might be knowing. So all the channels where the mutra is being transported are considered under mutra vahasrotas, which are two in number, and the root or the mula of this srotas is considered as vrika or the kidneys, and vamshana, that is the bladder area. And if we go through the classical textbooks, especially surgical books like Susruta Samhita, we will get the term vrika, which represents the kidney, and it is formed during the birth from the essence of Rakta and Medas. So that is why whenever we treat disease of the kidney, we should always think about medicines that are effective in Rakta and Medodhatu involvement. And Vrika is also considered as the root or mula of Medovahasrodas. Again, this is important, especially in diseases like nephrotic syndrome, where we can even find lipid abnormalities because of the defect in the kidney. And the bladder is represented as Vasti in Ayurvedic textbooks. So Vasti is the area where already the formed mutra is collected, stored, and then excreted from the body. And if you look at the process of formation of mutra, the modern medicine says that the actual formation starts in the kidneys. But in Ayurveda, the formation of mutra starts right from the functioning of the Agni. So Agni, in the influence of Samana Vata, acts on the Ahara or the food to form mainly two components. One is the Annarasa and the other one is the Mala. And this Mala bhaga is separated into Purisha, that is the stool, and urine. Then in the Pakwashaya, once this segregation happens with the help of Agni, then in the Pakwashaya, the Samanavada also enables the absorption of the water content from the Malabhaka. And then this formed mutra is collected in the Vasti, and later on it is excreted with the influence of Apanavada. So that is why whenever we treat diseases of kidney like renal failure, we should always start treating from the Agni and also consider Samanavada and Apanavada while deciding the medications. And the functions of mutra has been explained as to regulate the kleda or the water content in the body, so to eliminate unwanted kleda from the body. And this kleda, when not eliminated properly from the body, especially in diseases like renal failure, this kleda can get collected in and act as ama, later on leading to lot of disorders. If you look at diseases like diabetes or prameha, there itself there is excessive excretion of kleda through the mutra. And there are also symptoms explained when there is dushti or defect in the mutra vahasrotas, which include change in the quantity of urine, that means either decrease or increase in the quantity of urine, or alterations in the flow dynamics, painful micturition, or changes in the quality of the urine. And when you come to the clinical assessment of patients with urinary disorders or kidney diseases, if we go through the classical textbooks, we cannot find a single disease or specific one-on-one correlations of Ayurvedic diseases with that of the modern diagnosis. So that is why they cannot be mapped onto specific diseases enumerated in Ayurveda, whereas they may fall under different disease spectrums according to the clinical presentation in the given patient. For example, A patient with a chronic kidney disease or chronic renal failure can have vomiting as a predominant manifestation, then we may have to take medicines from the Chardi disease spectrum to treat such patients. And most of the times, the patient can also present in a SOFA spectrum where whole body edema or edema around the face and edema in the feet, that is the main presentation. Then, in such cases, we may consider medicines and treatment measures from the SOFA spectrum. And some of the times, the patients may also present with anemia as a predominant manifestation. Then, we may have to give medicines from the Pandu spectrum. So that is why it is very important to do a meticulous clinical assessment of the patient to identify which symptom predominance is present in the patient before planning the treatment. So these are some of the important spectrums that we have to consider when we treat kidney and urinary disorders. Patients presenting with dysuria or painful urination due to infections or other causes, they fall under the Mutra Krichra spectrum. If there is any obstruction into the flow of the urine, so if the pain is less but the obstruction is more, then we may have to consider the Mutra Ghata spectrum. And also, if there is calculi, urinary calculi, then we also have to consider the Ashmari spectrum. And sometimes, if there is a kidney involvement and the urine formation is not happening properly, then we also have to consider the sum of the functioning of the Agni as such. So we may have to take medicines from the Grahani spectrum to manage such cases. Chardi, Pandu and Shofa I have already explained, but we need more detailed discussion about Prameha. So any disease where there is increase in the quantity of the urine and if there is any change in the quality of the urine, that should be considered under the spectrum of Prameha. But Prameha not only means diabetes mellitus, because diabetes is only one of the diseases that fall under the Prameha spectrum, but there are several other diseases where the quality of the urine can change, which is included under Prameha. If you go through the 20 types of classification of Prameha, only one or two will correlate with the diabetes. All the others, for example, Kalameha, where there is blackish urine, alkaptonuria is one condition where there is, because of the metabolic error, there is a change in the color of the urine. So all those diseases will come under the Prameha spectrum. And whenever there is any mass or any new growth formation or diseases like polycystic kidney disease, so whenever we treat that, we may have to treat in the line of Gulma Chikitsa. And when the renal failure reaches a terminal stage, where because of the toxic metabolites circulating in the blood, which leads to central suppression, then the patient can land up in the state of Shwasa or Hikka, where because of the respiratory center involvement, the patient will present to you with altered breathing patterns or hiccups. So now you might have understood that the diseases and presentations relating to the kidney can map onto several disease spectrums in Ayurveda. There are more which we can discuss in the upcoming classes. So when we go to the examination part, when we start examining the patient, so our first attempt should be to identify which spectrum the patient presents with. And along with that, all the other conventional diagnostics like assessing the dosha, dushya, then status of the Agni, prakriti, etc. factors of the patients are also important. One of the other important factors that we have to assess is Udavarta, where there is abnormal movement of the Vata, and which is usually found in case of most of the chronic kidney diseases. So along with assessing all these factors, it's also important to identify the predominant etiology or nidana in the patient, which can fall under Sandarpana or Apatarpana. Sandarpana indicates excessive nutrition. So if a patient has been exposed to Sandarpana or excessive nutrition for a long time, then we may have to go for the line of Sandarpana Janya Vyadhis or diseases.
Could you please repeat the last term?
Yeah, when we identify that the disease has happened in the patient due to excess nutrition, then we may have to give treatment in the line of Sandarpana Janya Vyadhi. That means diseases, the treatment lines meant for diseases rising out of excessive Sandarpana. Or else some patients may fall under apatarpana, where because of lack of nutrition or disordered nutrition, the patient has landed up in the disease. Then we may have to manage accordingly.
И вторая категория апотарпана – это когда причиной становится недостаток или нарушение питания.
Then we should also look into poor prognostic indicators in the patient, which includes Agni Nasha, that is lack of proper digestion, and Aruji, that is distaste to the food. Other poor prognostic indicators include Balahani or loss of strength and weight loss. Then Shwasa, Hika, I already told. Shofa or Udara, that is full body edema or ascites, and also altered sensorium in the form of moha and murcha. Now coming to the line of management or the main measures for treatment. So the first measure will be to address the Agni. So we have to go for Deepana, that means which increases the Agni, and Pachana, that means which takes care of the Ama. And as I already told in the physiology, that Samana and Apana Vayu are very important in the functioning of Mutra or the renal system. Vadanulomana or normalizing the physiological movement of Vata is very important. Then depending upon several indicators in the patient, we may have to go for either Shodhana or Shamana type of therapies, where in case of Shodhana, we have to plan for the Panchakarma therapies. So in case of Panchakarma, not all Panchakarmas are feasible in some of the kidney patients, but the main important ones that we can do include Virejana and Niruhavasti. Then when coming to Shamana, where we try to pacify the doshas instead of eliminating them, mainly we can use measures like medicines, diet and lifestyle. So in Shamana, when we select the medicines, the following characteristics of the Mutra has to be taken into consideration. So whenever there is change in the quality of the urine, then we may have to select medicines in the form of Mutra Prasadana, which improves the quality of urine. And if the patient has reduced urine output, if the patient has increased urine output, as in Prameha or other disorders, then we may have to give medicines which has Mutra Sangrahana, that means which regulate or reduce the quantity of urine. And in patients where the urine output is very less, then we may have to give medicines which increases the urinary output in the form of Mutrala medicines. And we may, when we give Mutrala medicines, they also tend to eliminate Kleda, unwanted Kleda from the body. So Kledahara, which reduces the pathological fluid accumulation from the body, also is another Shamana measure.
Okay, so is Mutra connected with Kledahara or not?
Yeah. Because when we increase the output of the urine, ultimately the Kleda also will be eliminated from the body. So most of the Mutrala drugs also will be doing Kledahara. And after Shamana, we can also go for Rasayana measures, especially if you want to prevent the relapse of the diseases. So these Rasayanas, the drugs selection should be based on their action in the Mutra Vahasrodas. Some of the examples include Shilajatu, which has a very good action in Mutra Vahasrodas. Shatavari is another drug. Punarnava is another drug. So like this, we have specific drugs that can act specifically in the Mutra Vahasrodas. And these are all single drugs. And we also have polyherbal formulations which can act as a rasayana in Mutra Vahasrodas, which include Sukumara Gridha, then Chandraprabha Vati, which we are going to discuss later on. So like this, there are a lot of polyherbal formulations that we can use for rasayana effects. And when it comes to chronic kidney disease, we may have to go for a multi-pronged strategy where we select medicines from different spectrums depending upon the patient's presentation. So when a chronic kidney disease patient comes to us, we usually stratify them into two groups, where one group where the creatinine levels are less than 10, and if the patient doesn't have too much symptomatology, then we will try to keep only with Ayurvedic medications, and we prevent the future possibility of dialysis. And we also, the second group, that is patients who are already undergoing dialysis, we can also give Ayurvedic medicines to improve their quality of life and also to increase the gap between the dialysis. And along with the medications, we also have to give recommendations regarding diet and lifestyle modifications. Especially, we have to restrict the intake of salt, then excess water, excess proteins, potassium, phosphorus, and calcium, especially in patients with the renal failure.
Sorry, could you please clarify? Excess water is good or bad?
Bad. We have to restrict all these things, including salt, excess water, then excessive proteins, potassium, phosphorus, and calcium. And we can also give medicated diet, where dietary preparations processed with Ayurvedic medicines can also be given to improve the quality of the life as well as the Agni functions. Along with that, we can also give yoga, meditation, and other measures to improve the psychological profile of the patient. So, if you look at the scope of Ayurveda in disorders, in some of the diseases like urinary tract infection, chronic kidney disease, renal calculi, benign prostatic hypertrophy, etc., we can use Ayurveda as a standalone therapy. And in other cases where the patients need modern interventions, we can always add Ayurveda as an add-on therapy in diseases like chronic kidney disease, UTI, urinary tract infection. Then the new age diseases like bladder dysfunctions because of diabetic neuropathies. So in all these conditions, we can give Ayurveda as an add-on therapy. We can also use Ayurveda for promoting the well-being of patients in chronic disease states with the help of dietary advices, yoga, and other rasayana therapies. Chandraprabha Vati, and it is a very common drug used in Ayurveda, and most of you who are practicing might have heard of this drug. And it's traditionally indicated in Mutravah Srodhas and other systemic metabolic imbalances. It is a herbo-mineral preparation where there are herbs as well as minerals, purified minerals used in the preparation. And it is so effective that it is even used by some of the modern doctors in India. The formulation is a very complex one with several drugs in that. But some of the important herbal constituents include Shilajatu, Gugulu, Haridagi, Bibidagi, Amalaki, that is Triphala, Musta, Trikatu, etc. And the mineral components include the purified forms of Loha Basma, Swarnamakshika Basma, Yavakshara, etc. The dose, it can vary depending upon the company. Usually it varies between 250 milligram and 500 milligram, where 500 milligram is the standard dosage. It can be given as 1 or 2 tablets twice daily. The anupana or the vehicle or adjuvant can be warm water. Usually in general uses we use warm water. Or else, depending upon the clinical condition in the patient, we can use kashaya of guduchi or gokshura or punarnava and so on, depending upon the specific condition in the patient. And for rasayana effects, we can also give this medicine along with milk, especially in patients where there is dhadukshaya. So Chandraprabha, basically it has a rasayana property, but there are several actions for this formulation. And one of the important one is Mutrala, so that it promotes the urinary flow and has a mild diuretic effect. And it also has a Shodhara or Shofahara property, where it reduces the edema as well as the inflammatory. So it can be also given in infections of the urinary tract. And it also acts as Amapajana, but not in the Koshta level, but in the Dhatu level. So if there is an Ama in the Koshta, we are not supposed to give this medicine. But if the Ama is present in the Dhatu level, Chandraprabha Vati can take care of the Ama in the Dhatu level. And it also has a Agni Deepana effect in the Dhatu level, so that it can increase the Dhatu Agni. And it also has properties of Klayadahara and Vadanulomana. And Rasayana, I already told that it is basically a Rasayana drug. So the important clinical uses include, in case of urinary disorders, dysuria, recurrent urinary tract infections, urinary retention, bladder irritation and dysfunctions, and renal calculi. And in other, we can also use this in other renal and metabolic conditions, including early stage kidney disease, especially chronic kidney disease, diabetic complications, then edema associated with metabolic and urinary imbalances, and post-infective states of urinary tract infections. It can also be given as an add-on therapy It's especially helpful in long-term rehabilitation of patients like cardiovascular disease, then stroke patients, where it has that racine effect and a multi-system effect. So we can also use this in the rehabilitation of other systemic disorders as well. Just like the modern medicine, they give aspirin to prevent cardiovascular complications in diabetic patients. We also give Chandraprabha in small doses on a regular basis to prevent diabetic complications in patients with diabetes. There are some contraindications for the use of this tablet. Especially, it is better to be avoided in pregnancy and lactation, and advanced kidney failures, and also patients with non-allergy to herbal medicines. It is better to avoid the use of this tablet. So that is for today's discussion. We have just looked at an overview about Ayurvedic, general Ayurvedic approach in kidney diseases and use of Chandraprabha. I thank all of you for your patient listening. And if there are any queries, we can take it for around 5 to.
Okay, so the first question. In case of a gout, do you need to treat kidneys, or where do you start?
In which case?
In gout.
In gout.
Yes.
Yeah, in gout, actually, we have to treat the Agni rather than the kidney. So usually we treat gout in the line of Vaidyaratnam, Vada Shonita Chikitsa. But we should start from the Grahani so that we have to correct the metabolism. So what we usually do is, if the patient has acute symptoms, we directly give Vaidyaratnam Chikitsa. And once the acute symptoms are reduced, then we try to correct the metabolic error, that is the Agni.
Okay, are there some Ayurvedic treatments to reduce or remove renal lipoma?
We have tried several medicines, but we can prevent the increase in the size of the lipoma, but a total removal may not be possible. It may be needing surgery. I have typed 2 medicines in the chat box, Varanadi Kashaya and Kanjanara Uglu. This can be tried in patients. It may prevent the increase in size of the lipoma further.
Okay, so in Chinese medicine, there is the relationship between kidneys and joints and ligaments. Is there some analog of this understanding in Ayurveda?
Actually, in Ayurveda says that the kidney or vrika is formed from recta. So, and recta is also related to kandara. That means all these ligaments. So, if we want to make a comparison, we can do it in an indirect way, where both kidneys as well as the kandara, sira, etc. are formed from the recta prasada.
Okay. So, are there some Ayurvedic treatments for oncology disease like prostate adenoma?
We have very good treatment for benign prostatic hypertrophy. Only thing is that the patient has to take medicines for a long time. For malignancies as such, we can always give as an add-on therapy, not as a mainstay therapy.
What is the Ayurvedic recommendation for renal cysts? For example, in Russia, we have this burdock plant that is used in this condition.
Yeah, renal cysts always, the clinical features are very important. So in uncomplicated cyst, again, we have to go for reducing the kapha and medas. So just like I told Varanadi Kashaya, Kanjanara Uglu, we will usually give medicines like Varanadi Kashaya, then we have Nirgundyadi Kashaya. Okay, so like that we give which are Kapha and Medohara medicines.
So it's for an uncomplicated case, right?
Yeah, uncomplicated. Because if at all there is some complications, then we have to identify whether any other spectrum presentation the patient has. Then we may have to take that medicines from that spectrum as well.
Could you say that such procedures as yoga or abhyanga are generally useful for kidney health?
Yeah, actually, applying oil in the pada, that is Padabhyanga, is very good for kidney health. And yoga, definitely it is very, very much beneficial. Only thing is that if the patient has entered into chronic renal failure and the patient has full body edema, then oil application should be avoided. So as a prevention measure, all these are very good. But once the patient is totally diseased and there is chronic renal failure, it is better to avoid complex treatments like Abhyanga, or even only simple yoga, etc., can be given in such cases. So always it depends upon the status of the patient.
Okay, and are there some kind of general recommendation of herbs and spices for renal health in general?
No, it again depends upon the prakriti of the individual, because as a typical kapha vada prakriti may benefit from use of drugs like lashuna, etc., whereas pitta prakriti will benefit from the use of shadavari, yashti, madhu, etc. So generally speaking, we say punardava, shadavari are very good for kidney health, but again it should depend upon the patient's prakriti and other factors.
Thank you very much, Dr. Mukesh.
Thank you all for your patient listening.